Prynawn da, good afternoon everybody. I'm Dr. Frank Atherton and I'm the Chief Medical Officer for Wales. And I'm joined today by Dr. Jill Richardson, who's our Deputy Chief Medical Officer for the amazing vaccine programme. So this week, ministers are carrying out their regular 3-week review of the coronavirus regulations. And they're going to have to make decisions about whether to relax restrictions and which restrictions and when they can be relaxed. And ministers are also considering a new set of measures for the summer going beyond alert level 1, measures which will be aimed to keep people in Wales safe while the coronavirus is still with us and still circulating, and as we increase the number of people in Wales who have had 2 doses of vaccination. Now, Welsh Government is going to publish an updated coronavirus control plan and the results of the 21-day review on Wednesday this week. So returning to today, what I want to do now is just to set out the latest information about the public health situation here in Wales. And then I'll just ask Jill to talk briefly about how the vaccination programme has changed the relationship between infections that we're seeing in the community and serious illness and hospitalisation, the harm that people experience. So we're in the 3rd wave of the pandemic here in Wales, and we are seeing extensive community transmission across the whole of Wales. We're seeing cases of coronavirus continue to increase as the Delta variant, which has become established, moves swiftly through our communities. And we have a slide just to demonstrate this, and it shows how the case rates here in Wales have changed in each of our health boards over the spring and into the summer months. And if you look carefully at it, you can see how rates in Wales fell to very low levels during April and certainly in May. And then by June, we can see that rates have started to rise and then rose very rapidly, first of all in North Wales and then spreading to other parts of Wales as the virus moved across the country. So we now have a situation where the case rates overall for Wales are 136 per 100,000, and for North Wales it's still higher than the average, it's 205 per 100,000. So in the space of 6 weeks, you can see that this fast-moving variant of the virus has entered Wales, and it's spread from initially 3 small clusters to cause more than 3,500 cases across the country. Thank you. So this means that cases are doubling here in Wales. Community cases are doubling approximately every 6.5 days, and the R number has now gone up, and it is estimated to be between 1.8 and 1.9. So that means that for every case that we see in the community, that person goes on to infect almost 2 other people. Now, in previous waves of the pandemic, the first 2 waves, the pattern that we saw was of new infections, mostly among younger people, and then it would move into older people, and older people would suffer harm requiring hospitalisation. But this 3rd wave is different, we believe, and there are far fewer infections that we're seeing, and the rates are much lower in the older population, in the over 60s, than they are in the younger population, particularly the under 25-year-olds. And that's really good news. And a large part of that is likely to be that the vaccination programme is helping to protect older, more vulnerable people here in Wales. So what I want to do now is just to hand over to Jill, and she'll take us through the latest evidence about the vaccination programme, where we're up to, how effective it is, and what the next steps are going to be. Jill.
Diolch yn fawr, Frank. Thank you. I just want to start by thanking the thousands of people who've been involved in planning and running the vaccination programme in Wales, and everybody in Wales who said yes to the vaccination. Together, you have made this programme a real success and turned the course of the pandemic. Wales continues to have the highest levels of vaccination in the UK. 9 out of 10 adults have now had 1 dose, and more than 7 out of 10 have completed the course. The following slide shows how we've been able to protect people in the priority groups since we started vaccinating in December. More than 80% of people aged 50 and older, all healthcare and care home staff, care home residents, and people in the previously shielded group and at-risk groups have had both doses of the vaccine, which is incredible. And in some of these groups, more than 90% have completed their course. However, you can see that at the bottom of the slide, only about 75% of those 18 to 39 have had their first dose. This means that 1 in 4 of this age group are still not protected by any dose of the vaccine. These young adults are vulnerable to infection, serious illness, and life-changing long COVID, as well as loss of earnings if they have to self-isolate, as cases of the Delta variant are increasing in this age group. Our focus at the moment is on maximising protection, particularly amongst younger people. Health boards are running walk-in Pfizer clinics to make it as easy as possible for this age to get vaccinated. And I would urge anyone in these age groups to come forward for their vaccine as soon as possible. And please encourage your friends, partners, workmates, and family to do so. If we can continue vaccinating at this rate, we will have fully vaccinated 1.9 million people, more than 3/4 of adults in Wales, by next week. And the more people who are vaccinated, the better protected everyone in Wales will be against the worst effects of the Delta variant, which is rapidly increasing. We are not seeing the same levels of hospital admissions as we saw during the winter, but we can expect hospital admissions to rise, especially amongst young people or the unvaccinated and those who have not yet completed their course. Since the beginning of May, COVID-confirmed hospital occupancy in Wales has been at the lowest level since the pandemic began. There has been a small increase, however, in recent days, but we're continuing at low levels at present. The percentage of people with COVID-19 in Wales who were hospitalised has fallen from around 10% of cases in December, before the introduction of vaccines, to around 1% for cases of the Delta variant. Thankfully, COVID deaths are also at their lowest level since the start of the pandemic. So we can confidently say that vaccines have weakened the link between infections, serious illness, hospitalisation and death, but they have not broken the link. And that is why it's really important to have high levels of vaccination in all age groups, and why we need to work together to keep coronavirus under control, because the virus can still cause harm, especially if rates rise very steeply, as we are expecting. Back to Frank.
Thank you very much, Jill. Look, the last point you made is really, really important. It's very easy to think that once we've been fully vaccinated, we're somehow invincible. And it's very tempting to think that once we reach a certain level of vaccination coverage in Wales, that the pandemic will be over. But unfortunately, the virus is still with us. Cases are still rising during this third wave. And although we have weakened the link between the virus and serious illness, as Jill rightly says, we haven't broken it completely. So if cases come close to or even exceed the December peak, that's a lot of people who could still become ill, who would need to self-isolate and who would miss work and possibly develop long COVID. So we do need to continue to proceed with caution. We can all play our part in protecting ourselves and our loved ones by doing the small things that we've learnt about that will keep Wales safe. First and foremost, of course, if people have symptoms of any respiratory disease, but particularly of COVID, then they should self-isolate and get a PCR test. Secondly, we need to maintain that physical space between ourselves. We need to make sure that we're regularly washing our hands, that we're meeting outdoors rather than indoors wherever possible, that we're working from home if we possibly can, and that we continue to wear face coverings in indoor public spaces where that's required. And it's also important to make sure that indoor spaces, wherever we are properly ventilated. Now, the First Minister will be here on Wednesday afternoon to update you about the outcome of the 21-day review. So thank you very much, Diolch yn fawr. Jill and I will be happy to take questions from journalists, and as usual, all of the answers will be broadcast on Welsh Government social media. So I think first off we have Dan Davis from BBC Wales. Hello, Dan.
Thanks, Dr. Atherton. I won't direct this question to either of you. Whoever's best placed, please answer. You've again talked about weakening the link between, with the vaccine, weakening the link with serious illness. At what point will you be able to say that the link has been broken?
Well, I don't know if we'll ever reach the point where it's completely broken, Dan. I do expect that, with this wave of coronavirus, this third wave, we are still seeing some people, unfortunately, who are running into harm. Some of them are in younger people, some of them are in older people. We have to remember that the vaccine is very effective, the vaccines that we have, but they're not 100% effective. No vaccine is. And so people will still continue to experience harm to some degree as long as the virus is circulating. And we really need to wait and see what the future brings. I often think about comparing this with a pandemic, with seasonal flu, because every year, of course, we have seasonal flu. It comes and it brings harm to people, and that's really unfortunate. And I think we will ultimately move to a position where coronavirus is a bit like seasonal flu, that it brings harm every year. We need to manage it, and we need to bring into play those things which keep us safe. But that's really thinking about the future. I think we've got a difficult winter potentially to get through, but we can't say it's completely broken. It's certainly weakened. The vaccines are really holding up well in terms of protecting our communities from serious harm.
In that case, what are you waiting to see in the data that will give you confidence as advisors to ministers to say to them, now is the time to lift restrictions, or that would be the best moment to lift restrictions?
Yeah, Dan, that's a very good question. And obviously we continue to look at the things we've been talking about today, the case rates in the community. But they're just one measure, and we increasingly need to look at what's happening in our hospitals. So we look at hospitalisation rates. We look at the rates of people going into ITU, still very low here in Wales. As of last Friday, we had only 5 people in intensive care units. And of course, we look at the number of deaths that are happening. And we've had many days in the last fortnight when we've had no deaths. And, occasionally we have one death. All deaths are tragic, of course. But the numbers of deaths we need to monitor. And we also need to look across what's happening in other parts of the UK, because the trajectory we're on in Wales suggests that we're, 2 to 3 weeks behind what's been happening in England and in Scotland. And so watching the hospitalisation and death rates and the intensive care unit admission rates in those countries is very important and helps ministers here to make decisions as well. Thank you, Dan. And secondly, we have Adrian Masters. Adrian from ITV Wales.
Thank you, Dr. Atherton. And again, this really is a question for both of you, and whichever one of you feels the need to answer it, I'd be glad of it. And it's a question on the timing of changes to the face covering rules. There have been announcements already on schools and the fact that face coverings will be compulsory in certain settings, but when will there be a decision on the wearing of face coverings in shops and hospitality? Will that come in the announcement you mentioned on Wednesday? And assuming that they continue, what would you say to businesses that might be concerned that they would be disadvantaged compared to those in other parts of the UK?
Yeah, thanks, Adrian. So what I would say about that is that you're right, there's been some announcements already. The First Minister made it very clear that he expects to continue to have compulsory use of face coverings in places where people cannot make choices. So places like health and social care settings, of course, and also public transport. The question of retail outlets remains outstanding, and it's one I know that ministers will be looking at this week. So I would expect the timing, in terms of your question, the timing of that to be decided by Wednesday. So it's something you can ask the First Minister about on Wednesday. You know, if they do continue to be mandated in retail outlets, in shops, in supermarkets, etc., well, you know, people in Wales, you know, generally have been very supportive of the continued use of face coverings. In fact, you know, our public surveying, asking people what they think about in Wales, you know, does suggest very strongly that people are quite anxious about abandoning all of the measures that we've come to know that keep us safe. They do look at it, we do look at it as well as a part of a package of measures, not just in isolation. But all of those issues will be considered by ministers this week.
Thank you. It's fairly clear that there will be different approaches between that taken by the Welsh Government and that taken by the UK government for England. We're used to that sort of thing. But it does seem that there'll be much more emphasis on on the voluntary aspect of things in England, and urging people to be cautious. Can either of you say how you envisage that working with such a different approach on both sides of the border? And Dr. Richardson, given what Dr. Atherton has been saying, are you concerned that the Welsh NHS might be overwhelmed this winter?
Yeah, thanks. So, you know, on the first point, I mean, clearly there have been differences between the nations in the past, and that will continue. Welsh ministers have historically, over the course of the pandemic, been more cautious, and that's been supported, as I say, by the public survey work that we've undertaken. The public generally are appreciative of that. So we have to wait and see what happens and what transpires on Wednesday, I think, as to you know, exactly what those differences are. But let's see that. And over to Jill.
Yeah, so Adrian, I think we're always very concerned that the NHS is being asked to do a great deal. They're now in the recovery phases, so they're trying to catch up with all the work that has been waiting. Clearly, it's going to be a rocky road for COVID, and also for flu, also for respiratory syncytial virus for children. So the NHS is facing a challenge, but our NHS has so far been able to meet that challenge, even though it has been very testing. However, if we can persuade the quarter of all those 18 to 39 who have not yet been vaccinated to come forward, this will decrease transmission in our communities, and it will help family transmission and workplace transmission. So come the winter, we will be in the very best place to protect the NHS.
Thanks, Jill. Thank you very much, Adrian. And Mark Smith from Wales Online.
Thank you very much indeed, both. As you previously mentioned, First Minister Mark Drakeford is set to make an announcement about the next steps for lockdown this Wednesday. Can you give us your expert insight into the reasons for continuing masks, social distancing and school contact bubbles in Wales, when we're told by you that the link between COVID cases and hospitalisations is weakening?
Yeah, thanks, Mark. Well, look, as you've heard me say, we do have very extensive transmission of coronavirus in our communities at the moment. And, you know, obviously the main thing that we worry about is about the harm in terms of those harms that Jill was talking about hospital admissions, ITU admissions and people dying. But there are other potential harms from coronavirus. So we have to think about the possibilities of long COVID. We don't know quite how many cases will translate into long COVID. We have to always weigh up the possibility that new variants can emerge, variants which might escape our vaccines. We've been fortunate that has not happened to date, but we need to guard against that. And so high levels of community transmission can also cause that. So there are other considerations. And it's these three harms, the three types of consideration, which we need to bear in mind in terms of how quickly we relax our restrictions here in Wales. And those are the issues which ministers are looking at this week in terms of their planning, their mapping out of the milestones and the phasing of the release of those restrictions, Mark.
Thank you very much indeed. And perhaps this is more of a question for Dr. Richardson. Are you able to now give kind of a target date or at least an indication of when you expect all adults in Wales to have been offered both doses of the vaccine? And then do you expect the booster campaign to start in earnest soon after that?
Yeah. Well, we stated in our strategy, Mark, that we would offer by the end of September, but in fact we're going really, really well with our offer. And I would be optimistic that we can bring that forward. Certainly the booster doses will be important for the autumn. We know that if we have a 10% waning of immunity through vaccination or 10% lower coverage, then we may have about a 3-fold rise in hospitalizations and possibly up to 10-fold rise in deaths in the winter. So it's very important that those who first had their vaccines will be being called for their booster doses. So that's the cohorts 1 to 4, the care home residents and staff, health and social care workers, the over 70s and those in clinically extremely vulnerable groups, and they will be being invited in September. So we are really keen that we can optimise their immunity ready for the flu season and the COVID winter ahead.
Thanks very much, Mark. Yeah, and we have Peter Gillibrand from LBC.
Hello both, thank you for being with us today. My first question, let's go to London. In terms of a medical perspective, what did you make of the scenes of the crowds, the mass crowds gathering in London, and well, some people misbehaving quite badly? And we've heard a lot about this notion of personal responsibility and how the next steps involve personal responsibility, but is that the best way towards the next level of COVID restrictions?
Well, Peter, you're right to kind of flag that as an issue, and it is certainly a concern because, as we move away from legislation towards personal responsibility, towards more guidance-based approach, we have to kind of work with the public and ask the public to understand the risks that they're facing, not just for themselves but for everybody else. And it's certainly the case that throughout the football, we've seen cases of. We've seen an increase in cases in other parts of the UK. Certainly Scotland, I think, saw cases rise following the Scotland-England match with an export of coronavirus up there. UEFA overall, I think we've seen an increase in coronavirus cases. So there's no doubt in my mind that these large gatherings, particularly if they're not well managed, can lead to increased transmission, and that's not perhaps so surprising because we know a lot more now about how the virus transmits. The approach we try to take in Wales is to be a bit more cautious, to not have the huge gatherings, to have perhaps smaller gatherings. We understand absolutely the need for people to come together at those kinds of events to get back to some form of normality, but we will try to do that, I believe, and ministers tend to think in these ways here. We will try to do that in a slightly more cautious way. Yeah.
Just a quick knock on for that. You said, in terms of best, did you think it was very well managed in terms of where we're at the pandemic?
Do I think what was well managed, Peter? You mean the UEFA
Everything went on in London, yeah. Wembley, the mass gatherings outside Wembley. Well,
I can't really comment on how other nations manage their events. That's really for UEFA. That's for the Football Association. That's for the UK Public Health, the England Public Health authorities to really comment on. But I think what we need to do is to learn from what's happened elsewhere. We always try and do that in Wales. We've always tried to be outward looking and to understand what's happening elsewhere. And again, that's something that ministers will have to take into account as they start to plan and to give permission for larger scale events here in Wales. Thanks very much, Peter. Did you have another question, Peter?
Oh yeah, sorry, I did. That was just a knock on, if that's all right, just for a quick one more question. As it stands on Monday, we're going to look potentially at having drastically different rules in Wales to England. In terms of the planning for the next stages, have you taken into account the fact that some people may travel into England through our porous border? For example, young people might go to where I am in Cardiff, travel over to Bristol to go to nightclubs there.
Yeah, it's always a risk, of course it is. But, you know, Welsh ministers make decisions based on what's best in the interests of people here in Wales. And you know, my advice to people is, you know, people who live in Wales is to follow the rules here in Wales. This is not really the time to be gaming the system. So I would hope that people would behave in that way. But that's certainly a consideration, again, that ministers will be taking into account, because it always causes questions when there are differences across the border. Of course it does. Understand that. Thanks, Peter.
Thank you both.
And Lily Hewitson from GB News.
Thank you. Happy for either of you to take these questions. My first question is from one of our GB News viewers on Twitter. Professor Neil Ferguson, who's modelling for the first lockdown in the UK, has said the lifting of restrictions in England on the 19th of July are a gamble, but they're a gamble worth taking. What are your thoughts on this assessment?
Well, it's not for me to comment on, you know, what's happening in England, obviously. I advise Welsh ministers about what we need to do here. But my advice is based on what I understand about the virus and about the current situation of the pandemic. And there are a number of things which are favourable to making changes in the summer months as opposed to making them in the autumn or the winter months. And the sorts of things which, you know, I think about is that, and I advise ministers about, is that, you know, come the winter, of course, we could well be, as Jill has mentioned, into a difficult season because of flu. So we have to bear that in mind. We know also that the virus transmits less easily in warm summer months, and so the summer is in our favour to some degree there. We know that we have the school holidays coming up, and the universities and colleges will also be breaking up, and that again is in our favour because it provides a natural break in some of the transmission. So I wouldn't say, you know, it's a gamble or it's not a gamble, but it's a calculated decision that ministers in the different nations have to make, Lily.
Can I just come in there?
Sorry,
Yeah, just to say that, you know, if somebody says something's a gamble worth taking, I think it's for who, really? What about for those people with clinically extremely vulnerable conditions? You know, for those with learning disabilities, for others, you know, what is their view? Is it a gamble worth taking for them, if it were one, or not? Yeah.
Thanks.
Thank you. And just one more question. At what point do you think places like the Ice Arena, Wales, might be able to reopen? It's been closed for around 16 months. Figure skaters and ice hockey players are having to travel to rinks in England to train. What data do we have that proves socially distanced skating in a well-ventilated rink is actually more dangerous than perhaps sitting at a table of 6 indoors at a pub?
Yeah, and this has been a contentious one, and I think it's one of the things which ministers are looking at this week, actually, as part of the 21-day review, Lily. The original worries around ice rinks were that, you know, it's cold places with hard surfaces where the virus could spread, and, you know, we saw that in a number of certainly workplaces here in Wales early on in the pandemic. That's something which the Technical Advisory Cell has looked at and provided advice on, and it's something that ministers, I know, will be looking at again today, this week. So watch this space, I would say, Lily. Thanks very much. And then we have Rob Taylor from Wrexham.com.
Good afternoon, both. Dr. Atherton, previously I've asked ministers about hospital admissions and the split between those who are unvaccinated, first dose, second dose, and how many weeks after full course. That data appears to be published in England. Is there any detail of that yet for Wales? And if so, what is it telling you? And Dr. Richardson, with a look forward to the booster vaccines, what form does that take? Are you able to explain, is that a new product or is it the same dose but a different schedule?
Yeah, thanks, Rob. I'll ask Jill to comment on both of those, actually.
Yeah, so The booster doses, we're still awaiting final guidance from the Joint Committee on Vaccination and Immunisation as to whether they will be the same product or whether they will be one of the 3 existing vaccines that we're using in the UK, but a different, applied to different populations. And there are also some new vaccines, obviously, that are we're waiting to come through. So we're waiting to know exactly what product will be used for which group, but we'll be looking very carefully at all the safety advice and the advice of the JCVI as to what is used for which particular group. And sorry, what was the first question again?
Basically, if there's any detail on the hospitalisations that in England obviously mentions that people who've had no vaccine, first dose, second dose, etc., etc.
Yes, so we're waiting to get enough data because obviously at lower levels of transmission, so we've got, in excess of, 3,000 cases here now, and this will go up again this week. But England have got a lot more experience, and so we know that there are more robust data from there. But so far in Wales, it's looking like about half of the cases have had no vaccinations at all. And then there's a proportion, about 30% plus, who've had 1 dose, and then a small proportion who've had 2, but that might be within the 2 weeks to 3 weeks where they've not yet developed immunity. So it is looking like the vaccine does protect, but you need your 2 doses. So again, for all those that have been putting off going for their second dose, we'd really love them to come so that they can be well protected from this Delta variant.
Thank you. And Dr. Atherton, earlier you pointed to Wednesday on decisions over retail and face coverings and note that it's an outstanding issue. You spoke quite generally, but as CMO, what is your recommendation to ministers on this matter? And for Dr. Richardson, are you able to detail a bit more on the vaccine use split there? You obviously mentioned future vaccines potentially coming on course, but locally it appears AstraZeneca and Pfizer are the only 2 being given out in North Wales.
So my advice really is based on the evidence that we've compiled, and as I said earlier, on face coverings, we're asking Health Technology Wales and the COVID Evidence Centre to re-look at that, and I expect them to give us another readout by the end of July. But all the evidence that we have is that face coverings, not face masks, not medical masks, but face coverings in public places, there's a limited evidence that they provide some small benefit. But really, we have to look at them as part of the package of measures that remain in place. And this is what's concerning ministers, that thinking about as we move from level 1 to level 0, back towards normality, what are the package of residual measures which really need to be in place here in Wales to prevent the sorts of harms that Gilles has been talking about?
Yeah, thank you. And yes, just about the split. The first vaccine that came was Pfizer. Obviously, that was the first authorised vaccine. So that was what began to be used. And then the AstraZeneca vaccine came hot on its heels about a month later. And then sometime afterwards, the Moderna came through with authorisation. But the UK has not actually had huge amounts of delivery for Moderna. So in Wales, we have our fair share of all the vaccines, but the amount that we have had of Moderna was such that it was probably too small to be used throughout Wales. So we elected to use it in a health board with quite a lot of rurality. So because it was a little bit easier to get out to the rural areas than the Pfizer, and could be used for those groups that needed a Pfizer-type vaccine, so an mRNA vaccine. So Hywel Dda have been doing really well with us, with the Moderna, and also, and Iron Bevan has also had a little bit. But we anticipate going forwards that we should get more Moderna and possibly other new vaccines as well. But certainly for groups 1 to 4, the first ones who'll be having their boosters, they would have had AZ, many of them, and some of them would have had Pfizer. And as I say, we're waiting for JCVI's advice as to what they should have for their boost.
Thank you very much, Rob. And finally, we have Tom Owen from the National.
Hi. And this question is for either of you, really. You did mention restrictions moving beyond alert level 1. Can you give any indication of what those could look like? And would they be something that would, measures I should say, would they be measures that would apply to sort of wider community, or would they be more related to individuals?
Yeah, probably a mix of both of those, to be honest. You know, it's things like, you know, when we get to level 0, the point is that we're not going to be completely back to life as it was pre-pandemic, because there are things we're going to have to do to continue to keep ourselves safe, not just from coronavirus, but as Jill says, from other seasonal viruses which come out. And so, you know, we need to think about, well, what do we do about social distancing? What do we do about the 1 metre rule? What do we do about the face coverings that we've been talking about this afternoon? What do we do about personal hygiene, about ventilation, about those spaces? So there's a whole suite of things in both the gift of individuals and the gift of businesses, organisations, and societies, which we need to think through, and that's what's being considered now in terms of residual measures to help keep people safe.
Okay, and then the second question, specifically in relation to vaccination, and it's been mentioned the importance of that. I think it was 1/4 of 18 to 39-year-olds yet to have the first dose vaccination. What obviously vaccination centres have been requesting people bring ID. What reassurance can you offer to people who perhaps for some reason do not have ID or may have concerns about being required to show ID? Obviously, fairly recently, the UK government has been advertising that people may lose their rights to access to healthcare in the UK. What reassurance can you give to people that they can attend for the vaccine, either without showing ID or at no personal risk to their access to services and right to remain in the UK?
So, yeah, I think you're talking particularly about the case for asylum seekers there, Tom, and the fact that some of them are concerned that in England, if they go, that they might be data sharing. And just to assure you that in Wales, there is no data sharing with the Home Office of any health information at all for anybody seeking asylum. And for the having to show identification when you come to a vaccination centre, if you have an objection, nobody will turn you away. We desperately want you to have the healthcare that you're entitled to and the vaccine which is your vaccine, and that is waiting there for you. So please, if you are a partner, a parent, a workmate, a friend, a rugby playing friend of somebody, whatever you are, and you know that your mate hasn't yet had it, please encourage them, because that will keep them safe from long COVID. It'll keep them safe from hospitalisation, and it'll also keep their loved ones that are older and more vulnerable safe. So as a society, please don't have any concerns. If you have any questions or concerns at all, just drop in and talk to your local vaccination centre or email the health board on their website, gives details, and hopefully we can lay any fears to rest.
Will you consider advising vaccination centres to remove signage? Certainly I've noticed in at least one vaccination centre where the signage was actually wrong and it said photo ID is required. Obviously that's not correct. Would you
we certainly will. We'll certainly take that away to our operational team, Tom.
Thank you very much, Tom. Thank you, everybody. So on that note, I think, the point about vaccination, they are keeping us safe. They're helping to weaken that link between transmission in the community and harm. And I think the best thing we can all do is to get ourselves vaccinated and keep ourselves safe. Thank you very much, everybody.
Thank you.